And are there, now you mentioned, so I have a question for you. So you mentioned, a whole slew of different kinds of symptoms that could be indicative of an oral infection. Is there anything that we'd be able to tell, that would be more, like if you have a tooth pain, obviously that's easy to say, okay, that's could be an oral infection or some other problem. Is there anything other than just, you're tired and that, where you'd go, okay, that definitely sounds like an oral infection?
That's one of the tricky parts, is because there's not a lot of local symptoms. There's not a lot of local pain or things that we can identify. That test where you open your mouth and you say, ah, and can you see the back of your throat? That's a good one. Because if things are swollen back there, it's an indication that there's probably something going on infection wise. If you have had a root canal, 90% chance that there's probably infection underneath the end of it. So these are just all things to go, do I have it? Yes. All right. Probable. Look in the mouth. Are things swollen? Yes. Probable. As far as wisdom teeth goes, the big one for that is going to be endocrine problems. So if you have thyroid problems, Hashimoto's, you can't keep adrenal strength, you're just always wiped out, wisdom teeth areas, almost every single time.
Okay, so if you had an implant or root canal or wisdom teeth taken out, you should prophylactically, just go and get one of these cone beam.
Go have it checked out.
Perfect. Thank you so much. Our next question is coming from Diane. Diane, please state where you're from and ask your question.
Hi, I'm from Boynton Beach, Florida, and my question is about the implants. I'm supposed to get an implant, and I keep putting it off because I am afraid of, it affecting organs. I do have periodontal disease for many years now, but this one tooth is like shifting down and twisting, and it's affecting the tooth next to it. But I just keep putting it off. One, for financial reasons, but also because I know it's going to probably affect other organs. And I have a lot of stuff going on: ulcerative colitis, neuropathy, diabetes, and probably others. I'm just nervous talking to you. So I have a lot of stuff going on. So I didn't know what else you could add regarding implants.
The first thing that I can say is that tooth being infected like it is affecting you as well. So the things that you listed could 100% be related to just that infected tooth that you have that's shifting and moving. Teeth don't do that unless there's infection. And you said you have periodontal disease. That's gum disease. That's gum infection. So you have disease already in your mouth. The first step is get that tooth out. There are other ways to replace it. I don't know where the tooth is, if it's in the front or the back, but there's other ways to replace it other than a dental implant. But get it out, because that's the first starting point. Take care of the gum disease. That's the starting point. Don't even worry about the dental implant for the moment. Honestly, you probably shouldn't get a dental implant right now. If you have active gum disease, the dental implant has a higher chance of failure. Don't get it yet. Get the infection out first. Use removable appliances, retainers with teeth, those kinds of things temporarily for now until you can get infection controlled. Once it's controlled, then start looking at dental implants, those kinds of things. But now is not the time to do that. Now is the time to get the infection out. That's step one.
Great. Thank you. Our next question is coming from David. David, please state where you're from and ask your question.
Hi, this is David again from Framingham. So a follow-up question on the extraction, doctor. You state the risk that can be done from a not good extraction. How can I make sure that it's made right with my dentist if I need to make an extraction? And my next question is, what are your thoughts about electric toothbrush or ionic toothbrush?
So with the extraction, we do the same procedure that we do when we clean out the bone and cavitation areas. We make sure that the ligament is gone. So these are things to ask your dentist. Make sure the ligament is gone. We disinfect that area very well with ozone, and then we fill it up with those stem cells that I talked about. It's called PRF. So if you do those three things, then you're not going to have the problem of the area not healing after the tooth is removed. So you specifically need to ask for those. As far as a toothbrush goes, honestly, it's more important to me that you're brushing and using the brush correctly rather than the type of brush. So I'm not very specific on the type of brush. I don't care if it's electric or ionic or just your own hand, as long as you're just getting the things off of the teeth, using it properly, and not putting a whole bunch of toxins into your system with the toothpaste you're using.
Great. Thank you. Our next question is coming from Amy. Amy, please state where you're from and ask your question.
Hi, this is Amy. Thank you very much for the presentation. I'm from New York City. I have varicose veins along the side of my tongue, and the past month or so, they've become painful when they rub against my molars. Is there any way of removing varicose veins from the side of the tongue?
No, there is not, but it always is a sign. This is a sign or a symptom that we need to pay attention to. So if you have varicosities, it means that things are backing up and blood flow is changing in the side of the tongue. So we have to say, well, why? Why is that changing in the tongue? Most infection, in your case, it's probably an airway issue. I suspect you're not breathing very well at night. You're squeezing your teeth, which sucks the tongue into the sides of the teeth and causes soreness on the side. I suspect this is actually an underlying sleep apnea issue. So my first step for you would be to actually do a sleep test.
Okay, thank you.
All right. Our next question is coming from Paul, and this is, we just have like 1 minute to answer the question. So Paul, please state your question.
Hi, thank you. My question is about dental infections and cavities. I'm getting cavities even though I brush my teeth and floss. Does help? I know you spoke about tooth powder. I will try that. Does it help to swish your mouth with hydrogen peroxide or ozone? Or what else can I do to help prevent cavities besides brushing and going to dentist and get my cavities filled?
You need to look at gut function. Most likely you're not absorbing nutrients. So I have a remineralization kit that I would recommend you check out that has vitamins and minerals for the inside, tooth powder for the outside. Usually if you keep getting cavities and you're doing everything right, it means that you're not getting the nutrients you need and your body's stealing them from your teeth. So I would look at your gut first. Hydrogen peroxide and ozone are just going to kill bacteria. They're not going to add minerals back. So if this is a bacterial issue, you have too many bacteria, that's going to help. But I suspect it's actually a nutrient issue and you need more nutrients into the system and into your teeth than killing bacteria.
Great. Thank you so much for that. Really a very impressive presentation. It was very educational. So the audience, I'm sure, would like to show their appreciation as well. So we're going to open up the mics and you'll hear a whole cacophony of thanks.
Thank you so much.
Thank you very much. Thank you.
Thank you.